Welcome back, everyone. Monkeypox cases are on the rise with more than 3,500 confirmed cases in the United States.
So here in our region, Philadelphia reporting 54 cases, and now there is a third probable case of monkeypox in Camden. And this comes as the vaccine is being rolled out in Philadelphia. The Mazzoni Center is one of 5 facilities in the city giving those monkeypox vaccinations. Joining us live now to talk more about monkeypox is Dr. Rob Danoff of Jefferson Health.
Good morning, Dr. Rob.
Hey, Dr. Rob. Good to see you.
Good to see you.
So let us ask, first of all, can you talk more about how monkeypox spreads?
You know, this is an illness, a disease that spreads by skin-to-skin contact. So if you're with someone who may have the monkeypox and these type of lesions, we call them, that might start off flat and then all of a sudden they start looking like a blister that's pus-filled. If anyone's come in contact with linens or blankets or clothing, you know, that has been contaminated with that, that's how this spreads. So we know how it spreads. And the problem is, you know, trying to protect people from it. And one of the things is once a person is exposed to this, they may not even show any symptoms for between 5 days to 21 days. So the main thing is trying to figure out if you've been exposed to someone with one of these lesions or symptoms that may be related to monkeypox.
And speaking of symptoms, so we saw images as you were talking about those lesions. What other symptoms should people be aware of?
You know, this starts off almost like flu-like symptoms.
All right, it sounds like we're having some technical difficulties. Oh, all right, you dropped out there for a second, Dr. Rob. Can you just pick that up again, please?
You know, so one of the things is, I don't know if you can hear me, but, you know, these symptoms, they might, you know, flu-like symptoms and muscle aches and, you know, fever, often greater than 101. And so these are some of the symptoms that start. And just, you know, your stomach may be bothering you. It's just hard to eat, but it's just weird exhaustion. And then 1 to 3 days later, this rash may develop. But what's really unique about this monkeypox is that sometimes people don't have these flu-like symptoms. They just develop the lesion. And it may be a bunch. It may be starting in a person's mouth. It may be in the genital area. It could be the hands, the feet. And sometimes they may only have one, but sometimes they have multiple areas. So it's just something, if someone comes down with some of these symptoms, and there's a possibility that you have been exposed to someone with this, it's important to stay home, to isolate, really up to 21 days. And if you have any of these symptoms, call your healthcare provider. We're starting to have better access to testing now. So I suspect those 54 cases that Philadelphia has, we're going to start seeing more. The reason being is because testing now is becoming more widely available. Information is becoming more widely available about what to look for.
So, Dr. Rob, according to the World Health Organization, 98% of these cases involve men who identify as gay or bisexual. But is this something the entire community should be concerned about? Absolutely,
Jim. This is an equal opportunity type of infection. This can affect males, females. We've had young kids, 2 in our country that's been reported. So I just want to tell people this is not limited to just men. This can be anybody. So it has to do with your exposure, multiple, you know, sexual partners in an area, and Philadelphia unfortunately is one, that has some people with this disease. So it's important for everyone to take precautions, not to be scared, but to take precautions and be aware. Watch CBS 3 for the latest updates because you all are keeping everyone up to date about the cases. And Jim, I'm hoping that there's more vaccine that becomes widely available. People that need to get this, if you've had multiple sexual partners within the last 2 weeks in an area with monkeypox, if you know you've been exposed to someone, this is where the community has to communicate. If you know you might have these symptoms, contact your partners who you have been intimate with to let them know. The community has to kind of band together in this to protect everybody.
All right. Really appreciate your insight as always, Dr. Rob Danoff from Jefferson Health. Thanks, Dr. Rob.
Thank you. Good to see you both.
Thank you.
You as well. Have a great day.
And we'll continue to track the latest developments with the virus. You can learn more about the vaccine eligibility and the symptoms on our website, cbsphilly.com.